Welcome, and thank you for joining us today for the second Leo Gerard Legacy Fund lecture series, hosted by CROSH, the Center for Research in Occupational Safety and Health here at Laurentian University. If you don't read it on the screen, my name is Dr. Sandra Dorman, and I have the privilege of being your moderator for today. I'd like to begin by acknowledging the Robinson-Huron Treaty of 1850 and recognizing that CROSH and Laurentian University are located on the traditional lands of the Titchmachean and Anishinaabeg, and that the city of Greater Sudbury also includes the traditional lands of the Wahnapitae First Nations. As a descendant of settlers, I'd like to extend my deepest respect to all Indigenous people. For the lecture series itself, as you may know, the Leo Gerard Lecture Series was created by the United Steelworkers of Canada to honor and to continue Leo Gerard's lifelong efforts for labor rights globally. Leo wanted this lecture series to educate people, particularly on pressing priority needs for workers today, and CROSH is honored to both organize and host this lecture series. Just before I begin, before I introduce the speaker, I'd like to let you know that we're asking that you, we're going to have questions at the end of the presentation, and we're asking that you enter questions for the speaker using the Q&A feature. You'll see, I think it's usually at the bottom of your screen. Don't put questions in the chat. The chat is, as you're using it right now, is for group discussions. And if Courtney sees a question in there, she'll redirect you to enter it in the Q&A feature. As the moderator, I'm going to ask the speaker the questions in the order they come up. So you can ask them throughout the webinar, but we're not going to get to them until the end of the presentation, just so that she can get through her content first and foremost. Okay, so if that's all clear, it's my pleasure to introduce our speaker, Dr. Monique Gignac. She's addressing a pressing issue today in today's workforce, which is managing accommodation planning. Dr. Gignac is the scientific director and senior scientist at the Institute for Work and Health. She's also a professor at the Dalla School of Public Health at the University of Toronto. Her expertise is in health and social psychology, including disability. She examines psychosocial factors, so for example, stress, and how these factors impact disease. She's particularly interested in workplace communication, privacy, support, and accommodation needs for workers that are living with chronic disease and workers with chronic disease that have episodic conditions. I think she has a lot to teach us today. I think this is, particularly with COVID, it is a really pressing discussion. And I'm really excited to listen to her, so I'll stop talking and I will hand the floor over to Dr. Gignac. Please join me in welcoming her.
Thanks very, very much, Sandra, and welcome everyone. Thank you for being here this afternoon. I am delighted to be able to talk with you, share some information, some research that we've been doing about disclosure and accommodation planning, and particularly a new tool that we have been developing as part of our research. And now the fun begins because there we go. Sorry. Although I'm the person who's giving the presentation today, there's really a very large team behind this research. So we have a lot of folks with different types of expertise who have participated in the research. We also have a number of partners, and these include different types of health charities, the Ministry of Labor, Immigration, Training and Skills Development. We have an expert advisory committee of people with lived experience of different types of chronic and episodic conditions. And we have been funded primarily from two of Canada's federal granting agencies, the Social Sciences and Humanities Research Council of Canada and the Canadian Institutes of Health Research. But I also want to acknowledge that we received a small grant from Canada Life in the early development of some of our work. We also have received funding from Mars. I'll tell you a little bit more about that, and Employment and Social Development Canada for some of our knowledge translation work. So what I'd like to do today, just to give you a little bit of an overview, I'd like to set the stage and talk a little bit about disability in Canada and disclosure of a disability. I'll then tell you a little bit about this job demands and accommodation planning tool, the JDAPT that we have created, and something about the evaluation of the tool, just to kind of finish up. So starting with a bit of setting the stage, Statistics Canada in 2023, at the end of the year, released a report that said that about 8 million people in Canada report living with a disability. In other words, a condition that creates some limitations in participating in different activities or roles. Now, the limitation may be partly or primarily due to the condition, but it often is also the result of physical environments, social environments, and other kinds of factors that create the limitations. And that's really important to keep in mind, because it means if we can change some of those environments or social circumstances, we might eliminate or ameliorate a disability. Another important thing to keep in mind, and this was important to us in this work, is that over 60% of disabilities are considered episodic or dynamic. In other words, they aren't constant. People can have periods of time with few, if any, kinds of limitations, and then limitations may reoccur. Sometimes a disability may be progressive and getting worse. Other times it may fluctuate a great deal. And in addition to this kind of episodic nature, a lot of these conditions are unpredictable and invisible to others. In other words, people can be doing everything they should be doing to manage their condition and still have an episode or a flare, and others may not be aware that someone is living with the condition unless you share information with them. They may notice something seems different or not the same with people, but they won't know necessarily what it is. And I've put down a number of examples of different common mental health conditions, different physical conditions that are sometimes seen as episodic. There are a lot more. I've added long COVID to the list. We need more data, but it is looking like in some ways long COVID could be an example of an episodic condition. So what this all means is this kind of changing, unpredictable, and invisible nature of many disabilities is that there are a lot of challenges that we hear from workplaces, first of all, around workplace disability communication, whether people disclose, when, what they say, and how to protect privacy. It also creates some challenges in providing support or accommodations, because often things are changing and people want to maintain productivity. So this is really the space that this group that we've been doing research with has been operating in. And I should have mentioned earlier, we call ourselves ACE, Accommodating and Communicating About Episodic Disabilities. And we've been focused on creating a toolkit to help people with some evidence-based tools to address two questions primarily. First is, should I say something? And the second is, what can I do? And the link to the website is at the top, and I'll be showing this link repeatedly, so you'll be able to access it. And I think it's also in the chat. But essentially, we've created two tools. One is a communication decision support tool called Decide. That tool is going up on the website. It's not there quite yet. We're just finishing the programming and doing some testing. It should be up in the next month or so. And the second tool that I will talk about today is this job demands and accommodation planning tool. But before I tell you about the tool, I do want to kind of backtrack a little bit and talk about disclosure and sharing information to kind of put things in context for how complicated and difficult this whole issue of sharing is for many people. So across several Canadian surveys, and it is important to have Canadian data because legislation differs in other countries related to support and accommodations. But in Canada, in surveys that are totaling about 3,400 people, we hear anywhere from about a quarter to nearly half of participants who live with a physical or a mental health, or sometimes both types of conditions, will say that they have not shared any information about their limitations at work with their supervisor. You'll have more people tell you that they have shared with a trusted coworker. Even fewer people will say they have shared with someone like human resources or a disability manager or a union representative. There's no single correct decision. We hear a lot of diverse stories. So, for example, people who say they have shared information will say that, you know, this worked out well, it was a positive outcome, I got support, I got greater understanding. Sometimes, though, they have negative outcomes. Sometimes people say, well, now everybody's watching, I have to prove myself all the time, or they may experience stigma or gossip or a loss of reputation as a good worker. So for some people, they decide, well, they just want to avoid this. They won't say anything. And the outcome there can also be positive. People can talk about less stress, less concern about how others view you. They just don't know. At the same time, if you do need support, you may not get it. And there can be misperceptions about reasons for job difficulties. And what I mean here is that for things like chronic pain, some mental health conditions, conditions where fatigue is a big symptom, sometimes people leak symptoms and others don't know what's happening. They don't know why someone maybe is absent more often. And so they jump to conclusions. They might think this is not a good worker. This person's not motivated, they lack skills, or they're moody, they're hard to deal with because they don't understand what the person's dealing with. And so again, there can be some negative consequences to not sharing information. In addition, it's very complex to make these decisions for a lot of people. So people are often juggling a number of different facets in making their decision. They're trying to take into account what their current needs are. Are there some changes to their health or to their job? Are there safety concerns at work? People will have different goals. Some people are looking for information or access to supports. Other times people just want to protect their jobs, protect their reputation. People may feel they have an obligation to share, so their values and their preferences are different. Some people value their privacy. People will have had positive or negative experiences. And then there's information about the workplace. So that information will be what supports may be available to people, whether they exist or not. And then there's the culture that people will take into account. So people try to deal with all of this information, and sometimes it pushes people toward making a decision and to share, and other times it seems to pull people away, and it can be happening simultaneously. So in a study that our group did with 737 workers who were living with a physical or a mental health condition, or both, we've heard that about 56% of the people in this particular study had considerable needs for support. There were a number of things going on where support would have been helpful to them. We also heard that sharing was perceived as helpful if people had accommodation or information needs. And in this sample, about 70% of people said they had a number of supports available to them at their workplace. So all of this kind of lays a foundation for sort of pushing people to encourage them to share something about their health at work. But at the same time, for people in this sample, there were factors that were pulling them away from sharing. So although sharing might be helpful if you have accommodation or information needs, they were not actually the top goal for most people. Most people wanted to protect their jobs and protect their reputation, and they didn't want to share. We had about 30% of people who said they were willing to share and thought it was important, but 36% said they were reluctant to say anything, and 34% were unsure. Although many people said their organization had supports available, 20% of people only reported that they felt the culture was positive in terms of supporting sharing. Nearly a quarter were unsure or ambivalent. They, worked with good people, but they weren't sure this might come back to bite them somehow. And 57% of people said that the culture at their workplace was not really conducive to sharing at all. So that's, just to show you some of what people are trying to grapple with at the worker level. We've also done research with workplace representatives. So we did some qualitative research where we interviewed supervisors, HR representatives, disability managers, union representatives, labor lawyers, and others. And we asked them about the supports in their workplace and what that process was like and what the challenges were. There were 7 themes that came up. I won't go into them in detail, but I'll just mention 3 of the themes. So one of them was, again, workplace culture came back up again. In this case, though, workers or workplace representatives were often talking, they didn't use the word medical models, but they often said they had a model that we would describe as a medical model where it was important to get validation that the condition was real. And so that often involved notes from health professionals. And this model, although they felt it was an important one, wasn't working as well as they would like. And it wasn't working for a number of reasons. First of all, it was taking a long time sometimes to get the notes, and that undermined trust and delayed the support process. Sometimes there was concern that workers didn't want to get notes because it would kind of provide too much information for people in the workplace. So in other words, although the notes might be confidential, they may not even tell you what the diagnosis is. If you get a note from an oncologist or a psychiatrist or a rheumatologist, it's already giving you a fair bit of information about what the condition might be. And also the notes sometimes weren't particularly helpful. Health professionals weren't always able to provide the kind of information that helped guide a support process. So there was this sense that there was a need to implement more of a social model of disability where you focused on the workplace and what the needs were, but many organizations really weren't sure how to do this. A second theme that came up was that people had a lot of misgivings about other people who were involved in the process. So there are sometimes quite a few individuals who get involved in providing support, and everybody seemed to have concerns about everybody else. So for example, supervisors took a big hit here. People having concerns about their skills, their training, their motivation, and that this was really a hit and miss process sometimes with supervisors. Human resources came in for some comments, negative comments, that they often weren't really there for the worker. They were really there for the organization and sometimes weren't helpful. Union representatives, well, sometimes they're focused more on the group, and so they don't want to advocate for a particular worker because it looks like someone's getting special treatment. Clinicians, clever people, but they don't know anything about work. So again, everybody kind of came in for a little bit of negative feedback from others. And then the final theme I want to mention is that formal communication about a disability was often coming late when there was a crisis. Sometimes then a worker was away for a fair bit. They found themselves in this attendance management or attendance support program where they're now sitting down and they're not talking about support. They're talking about disability as a performance problem, where we need some disciplinary actions. And that was really hard to then move people away from this performance issue to a support kind of context. Sometimes people weren't believed when they introduced that there was a disability at this kind of late stage in the game. So that is a little bit about what we hear from workplaces. And the bottom lines here are workers are really looking for guidance on whether they should say something, how to get support if they don't want to share information, and what to share. Workplace professionals are really looking for more of a transparent, a consistent, and comprehensive approach to addressing what they know are individualized worker needs. And they want something that fits with their existing processes. And everybody would love to have more practical support and accommodation ideas. So that's to lay the groundwork for why we created this tool called the JDAPT, the Job Demands and Accommodation Planning tool. So essentially, we had a number of goals drawing on the research. We wanted to try to create something that would focus a little bit more on prevention and support rather than this kind of crisis focus that we keep hearing about. So something that would help people be more proactive. We wanted it to integrate well with existing processes. We're not trying to replace anything that's going on. wanted to have practical support ideas that are relevant to a really wide range of jobs and disability needs, sectors and organization sizes. We know we can't provide something that will be specific for every single situation. So we wanted to give enough examples to really help promote discussion and brainstorming, and so that we can improve the process and outcomes. Of course, being interactive, accessible, and evidence-based was important. And we knew we would have to protect privacy because people really just don't want to share so often. So what this JDAPT does is it focuses on work demands that may be challenging at times or regularly. It doesn't ask people about health or a disability diagnosis. So, and we're trying to move people away from that, because we know if someone says, well, I have chronic pain, I can't work. It's really hard. Where do we go from there? What exactly are the issues? Are there things we can do about it? So this really focuses on job demands. It guides a person through a series of simple questions about their job tasks and their working conditions. And then anywhere someone says they're having some challenges, the tool provides a list of support ideas that are relevant to those sort of personalized challenges somebody's identified. And we hope that they can help start generating some solutions. The tool can be used on one's own or can be used to discuss support needs with others. And back in 2022, we entered actually the prototype of a tool into a national inclusive design challenge. It was sponsored by Mars and CIBC. And I'll just say that we were the grand prize winners, which was wonderful, but we've been working on the tool ever since to try to enhance and improve it. So what you would see if you go into the tool, and please do, it's freely available. We don't collect any personal information. We'd love to hear how you found it. You would be asked 24 different questions about different job demands and working conditions. And they're organized into 4 sections. So there are some questions about physical demands of work, cognitive or thinking demands of the job, working with others, and working conditions. There's 3 versions of the tool. You can choose which one you want. There's a version a worker can fill out to self-assess. And there are 2 organizational versions. So there's a version that someone who's familiar with a worker can fill out, either on their own or with the worker. So that might be a supervisor or HR, union representative, could be a clinician, and they can fill that out. And then we were asked by organizations to create a version that didn't focus on a particular person, but focused on a job, because a number of organizations are wanting to make work more inclusive and accessible. They don't really know what's possible for particular jobs. So they can kind of go through different job demands and get some ideas of things that may or may not work, should they need to implement them to provide support. So what happens for each of those 24 questions is a user would be asked, first, is this an important aspect of the job? If they say no, they move to the next question. If they say yes, a worker would be asked, are you having any difficulties due to your health? And you can say not at all, or some, or a lot. The organizational version, is this worker having any difficulties with this task that you can see? You're not asked to attribute it to their health, just that they're having some difficulties. And then people are asked, does this change over time, or does it seem to be constant? From there, you get a personalized report. And these reports have turned out to be very helpful to people, because often it's overwhelming to have a chronic condition. You don't know where to start with what to say. It's hard to even describe what the issues are. And so by focusing on different job demands, it helps to start people thinking about where there are no issues and where there are some challenges. So you get the report, and it's linked to then a range of different strategies that you can consider for yourself. And you can save a PDF of everything. We don't save the material. So I'm just going to run through quickly some screenshots. I'm not going to spend a lot of time on this, certainly not the detail. I know you can't see it all. This is the landing page where you would choose which version of the tool you want. The tool is available, the JDAPT is available in English and French. Then you would choose the worker versus the organizational version. From there, you go to some introduction page where you hear a little bit about how the tool works and how we think it helps, what it isn't. So it doesn't provide legal advice. It doesn't provide clinical advice. After that, you see the instructions, and they're again in this sort of simple, is it important to your job? You're having difficulties, does it change? And we've heard from users that format is very simple and helpful, particularly people, for example, with neurodiversity, again, or where fatigue is an issue. There's a nice simple pattern here. And so people get used to it, and it makes it easier to fill out the tool. These are actually 2 screenshots of the physical demands questions. So for example, you might be asked, does your job involve activities that require physical endurance or stamina? And you can say whether that's important to the job or not. And then you go on. This is the working conditions questions. And I put this up just on the right there. You'll see a screenshot. And what to note there is you can, for every domain, you can write in some extra work demands. If you feel something isn't specific enough or it hasn't been raised, you can put it in yourself. You can save a draft of the tool and come back to it later. But once you do submit the tool, you do have to save it because we don't save anything on the website. These are, again, 2 screenshots very quickly. This is the report that you would get after filling out the tool, the initial part of the report. So there's a big 16 of 24 in the bottom left. What this is just saying is this fictitious person who's filled out the tool has said that of the 24 different job demands, 16 of them are relevant to their job. And then on the right, there's another screenshot with some bubbles. And essentially here you see 8 of 16. So of those 16 demands that are important to this job, this person is saying they're having some difficulties with 8 of them, half of them. And the other bubbles just sort of break it down by the different 4 domains. And of the 8 areas that are a problem, 7 of them change. They're not always a problem in this person's scenario. So people get the report. For the 8 items, for the 8 areas or job demands where the person said it was challenging at least some of the time, they would now get examples of things they could think about doing. So this is not the way it looks on the website, but on the far left, you'll see physical endurance or stamina. If someone said, this is a challenge for me, they'll get some ideas of things they can try on their own, things they can try at work, that may be things they can do without permission, and then more formal accommodations that they can think of requesting. For every one of them, we've tried to give some more concrete examples to sort of break out the activity. So really get people thinking and brainstorming. This now, next slide, is concentrating for long periods. So it's a different work demand, and now you get different types of strategies to think about. So again, to really help people focus then on the areas that are challenging and different strategies that might be helpful. And again, things you can do on your own, try at work that are fairly informal sometimes, and more formal accommodations with examples. You can see already with just 2 different demands, there's a lot coming up. So you can also create a personalized list. And so, for example, an organization that knows we can't provide work at home, for example, or we can't provide some of these other things, they can click on those supports that are more likely. So there's a more personalized list. The same for the worker. If they know some of these won't be helpful to them, they can create a personalized list for themselves. So that's essentially the tool. At the end, you would have an opportunity to save some or all of your output for yourself in a PDF form. Just a final sort of note, we did have some rules as we were putting together strategies. So some of the things we wanted to do, obviously, were to, create strategies or find strategies that would prevent harm and promote individual capacity, wanted to look at all different aspects of what could be done. So it's not all about the worker having to change. What can we do in the environment? Obviously wanted to be concrete and specific, saying, hey, you should avoid stress at work is not helpful. Wanted to find different examples and different supports people can, again, do on their own or with others' help. We do provide some lifestyle strategies, but really the focus is mostly on the workplace. And that was because that's where the big gap was. So there are lots of good strategies you can find out there for things like, you know, if you're tired when you come home from work, to kind of conserve energy, make big meals on the weekend and divide them up into portions and then thaw them out during the week to kind of help yourself with your energy. Great strategy, but not really relevant to work. We also had some things we didn't do. So obviously we're not providing any clinical or rehabilitation or legal advice. There are people out there that can do this and they are experts at it, and they should be the folks involved. We don't name products or brands. We try, again, not to be too prescriptive. We're not going to say work for 4 hours a week for 8 weeks and then work for 6 hours. That's really something that the workplace and the worker and others need to be involved in. We avoided strategies that we felt would be cost prohibitive, and suggestions that really didn't focus on a specific job demand. So, you know, it might be wonderful to create a support group in a workplace if there were enough people who wanted to get together, but it doesn't really link to a job demand. And so for the JDAPT, that's really where the focus is. So that's the tool and some of the thinking behind it. I'd like to just finish this afternoon with a little bit about some of the evaluation. We did evaluation all the way through, and we're continuing to do evaluation. So we started with some needs assessments. We did a formative evaluation to look at the comprehensiveness of the tool and its relevance. We've done some longitudinal follow-up, and we'd like to do some implementation evaluation as we move forward. In terms of our early evaluation, and a study is published and available on open access, here we did a very labor-intensive study where we had 46 workers and 23 organizational representatives, again, you know, supervisors, union reps, HR, and we went through every single question in the JDAPT, and we asked people, does it make sense? Is it relevant? And we got, you know, perceptions of comprehensiveness. People were very positive about the tool. We did add 3 new items at that point. So there were 21 items originally, and now there are 24. These are just some comments about the tool. It seemed like you covered every piece, whether it was the physical piece, tedious work that's happening over and over again, or working long hours, traveling. So you've covered everything. And that was a baker living with ADHD and a skin condition. There were basically all of them that I go through in my job. It's basically everything I do at work. I was a truck driver with Crohn's disease. And finally, someone said, I go in and just say, I'm dealing with a mental illness. And my boss says, what do you need? And I say, I don't know. I think the JDAPT might be better to help me understand actually these 3 aspects of the job are what are difficult for me. So let's think about what we do with those. And that was a government worker with depression and PTSD. These are very representative of the types of comments we heard. I mention them, as you can imagine, because the jobs themselves and the types of conditions were all very, very different. But there was some indications that this was really a tool that could be used quite broadly for a range of people. We also did a longitudinal evaluation. So here we followed people for 9 months. We asked them first a lot about their work. They had never seen the JDAPT. We then gave them the tool. They filled it out, told us what they thought. 3 months later, we went back to them and said, did you use the JDAPT at all? How did that work for you? If you did, why didn't you? If you didn't, and then 6 months after that, or 9 months from the beginning of the study, we went back again and asked, did you use it? So just very quickly, 84% of people said the tool was very extremely easy to understand and complete. We saw significant changes in people's confidence, or what's sometimes called their self-efficacy, in their ability to solve problems at work, meet their job demands, and deal with stress. So people said they were more confident about these. People reported fewer work productivity problems. There was less absenteeism over a 6-month period. And the findings were very similar by gender and age and condition type, whether you were part of a union or not. And what that meant to us is that the tool was working well for a number of different groups in different situations. Only 1% of people said the tool wasn't relevant to their job, and only 3% said it was too long. People did use the tool in quite different ways. So some people preferred to use it for themselves and not share information. Someone said it was empowering to see how much one can do on one's own, especially when I'm hesitant about being supported by HR. Another person created full and personalized lists of their strategies, especially when they had to return to working in the office. And then we had someone who also used their list of strategies and accommodation plans, plus the language of the summary to request a more formal workplace accommodations plans, and said that that was really critical in helping them explain how their disability impacts work and thinking about possible solutions. And they said, without the JDAPT, I wouldn't have gone through this, I wouldn't have had the courage, confidence to go through this intimidating process and advocate for myself in such an effective way. These, again, were very representative of what we heard. When people talked about problems, they were usually the organization, which wasn't responsive or at this point willing to kind of use the tools. They had their own processes. So that's something we'll look at more for the future. But just to kind of summarize, there are versions for workers and support providers. Often the job demands here are omitted in some functional assessment tools. We really wanted to appeal to a lot of different types of disability and job types. We think this is really something that could help enhance an existing process. So our recommendation is that people use this early in the support process and then use it over time to help monitor and look at needs changing. Again, we don't ask for personal information. We don't save information. The tool, the worker version's been available only since the end of March. And the organizational version, I think it was more September that it came out. Since then, though, we've been very pleased. We've had over 10,500 visits to the tools themselves, over 7,100 unique visitors to the tools. Some people are coming back, which is why we see the difference there in the unique visitors. Over 15,000 visitors have come from Canada to the website, over 3,500 from the US, UK, and Australia, and we've had a number of visitors from other countries as well. We're going to continue to share the tool. I would love you to try it and let us know what you think. We will also be launching our communication decision support tool, as I mentioned, in the next month or so, and would, obviously we're wanting to continue to do research here. So I'm going to stop there and turn it back over to you, Sandra, for any questions. And I see a lot. So I do want to say, I'll just leave this up for a moment. Please feel free to reach out to me. I'm not sure we'll get through all the questions, but my email is there, and love to hear from you.
Fantastic. Wonderful information. Exciting to see such a hands-on tool, for people to work with. So yes, let's dive into the questions. The first one I think you've actually just answered, but we'll make sure. Sharon wants to know, can the JDAPT be used in other countries such as Indonesia?
Yeah, so there will be some legislative differences. The tool doesn't really deal with any of that or how people's processes are. So we have had people contact us and say they are using it, often rehabilitation professionals. So I will say yes, but recognizing again that there can be differences in what you're required to do. And we only have the English and French versions of the tool. So we don't have, and some of the language is, jargony. But it's the language we use here. So accommodations, we have had some people say, oh, so this is about housing. No, it's not about that accommodation. It's about support.
Okay, the next question is the tool free?
Yes, absolutely. So it is kept on a separate website, and you can freely access it as many times as you like. And we don't ask for personal information, and we don't save the output. It's entirely yours. That was deliberate on our part. We know people living with disabilities face a number of challenges already. So putting a tool behind a paywall, we just did not feel that that was the right thing to do. So this tool is absolutely free.
Fantastic. Okay, would this tool be applicable and helpful for retail staff where working on site and attending to specific shifts is required?
We did have some participants who worked in sales and retail, and we didn't see any differences in their use of the job. Shift work is often a challenge for people. So I would say, definitely try it out. Again, we've had some good responses. Not all of the strategies fit every job. So obviously, work at home doesn't work if you're in the retail sector. Doesn't work if you're a teacher. But again, you can pick and choose from among the strategies. And we've tried to really think about the fact that people will have different job circumstances when providing different ideas.
Okay. Would this tool be ideal for non-occupational claims or occupational claims as well?
So I'm not sure I fully understand, but I'm going to guess what I think. So by occupational claims, I'm assuming you're talking about like an injury that was caused by the job or at work. And then non-occupational might be you're living with a chronic condition that's not caused by your job, but is impacting your work. So you might have anxiety that's that is not created by the job, but it might be exacerbated by work. So if you mean that, and apologies if you don't, the tool can be useful to both of those situations. Now, it's not, we have presented to different groups, including folks who handle occupational injuries, and they are interested in the tool as a way to help understand what, again, the job challenges are and the different needs that people are. Because again, we don't ask, how did this happen? Or what is the diagnosis or the problem? It really focuses on what are your job demands, and here are some ways that maybe you could manage those demands with whatever it is you're dealing with and however it was caused. But if it's, of course, an injury or something where there's safety at risk, other folks would absolutely need to be involved in those discussions.
I think that makes sense. This one, I'm not sure of either, so hopefully you'll understand, and if not, we'll move on, I guess, or maybe Rhonda can try again. Is there an estimated time frame when the corresponding workplace communication decision support tool will be released?
So we're hoping, so again, the tool is ready. We've developed it. We've got it programmed. We're doing some testing to make sure all the programming works, because it is interactive as well. So the way that tool works is you're asked a series of questions about different aspects of what's going on for you right now and your personal preferences. You get feedback as you work through the tool about, okay, it sounds like this is what your needs are. Sounds like these are your preferences. And then it links to the JDAPT. So we're doing, as I said, sort of some testing. And we will be doing that testing also with people with lived experience. We have an expert advisory committee, and we're hoping the whole thing the English version hopefully will be out end of June, early July, with a French version very shortly to follow. I don't know if that's what you meant by the time estimate.
I see. So ignore me. Okay. Can this tool assist in getting your healthcare provider to set you up with appropriate testing and diagnosis for physical or mental issues that you might be having, instead of just getting medications prescribed? There's extra here. I'll finish it. I think, yeah, diagnosis / a note from a healthcare provider might make someone feel more validated in discussing their situation with their employer.
Yeah, so good question. We have presented the tool to occupational physicians who and we have actually an occupational physician on the team. And that is a group that we think would benefit from having some access to the tool. So again, they could see, first of all, they can learn more about what the patient's job actually is, as opposed to trying to kind of figure this out. They could perhaps look over some of the supports with you to say, I think this would be reasonable or not. It is absolutely true that a lot of workplaces will require a note from a physician or a healthcare professional to kind of validate what the concern is, or what the challenges are. And the hope is that the tool can make those notes more informed. Because again, one of the things we do hear from workplaces is we get this note and it is just not reasonable. And so we've now reached this threshold of what's called undue hardship, where we can't provide this support. It's too costly. It's just too essentially part of the job duties. And perhaps if the health professional and the worker sort of had a better insight into what the issues are and what some of the supports are, a better, kind of note could be written to help inform a support plan. The JDAPT won't ever, I don't think, be the only part of the support plan, but it would help in that discussion.
That makes sense. Okay, from Tabitha, is the JDAPT a tool, or is there a general tool that employment service providers, example, job developers or coaches, can use to help support ourselves or a client when we are seeking to match them with a job or employer?
It's a good question. In this, if I fully understand, it's not a skills tool. Because it's not asking you what your training is and what your skills are and what and those aspects of the job. So I don't think it would replace that. It's really, but we have had, and we've spoken to some students transitioning to work. And we even heard some people in the evaluation study who said, I left my job, and where the JDAPT was really helpful was in helping me think about the type of job I really needed to be looking for. And so I think, employment service providers would need to do all that skills assessment. But where the tool could be used would be to say, well, if a job had this, and you're saying you really couldn't do that, then, maybe, let's say outside work or work where you had to stand for long periods of time, or public facing work, or work where there's no access to private space, working at a, sometimes we think that, oh, you're, long distance truck driving may not be for you, but also working at a kiosk at a mall where you can't store your medication, you can't kind of get away from people. That just also may not be something you could do. So I think the tool might have a role there, but it wouldn't be the only thing.
Okay. How do you help an employee who is dealing with ADHD and wants to work remotely 3 days a week and specifically every Friday? I don't know if you can answer this one, but do you have a suggestion for them on how you would use the JDAPT in that scenario?
Yeah, I mean, so, there could be lots of like the every other Friday, for all we know, is there's a healthcare appointment that's a standing healthcare appointment and they need time off for that. I know there can be reluctance to just kind of accept what someone says. And, legislatively, a worker is allowed to suggest that these are the accommodations that they need. A workplace doesn't have to provide you with exactly those. So if you say that you need to work at home because you have a lot of distractions, you have ADHD, and it's really hard for you to concentrate, a workplace can come back and say, you know what, actually, we need you here. We'll give you set you a workstation that's apart from everybody else, or give you a different room or whatever. They don't have to give you exactly what you're asking for. I would say the tool might be helpful, I don't know, to sit down with a worker to really sort of identify maybe better why it is that the worker thinks these are the accommodations that would be most helpful. So what are the job demands and the needs that have suggested that this is what the person wants to have? And that might be an easier way too. It's not necessarily, I'm, questioning the validity or the legitimacy. It's, hey, we need to have some more information here. So let's do it. Let's maybe do it together.
Yeah. And maybe it gives you a good path to have a collegial discussion.
Right.
With a purposeful outcome.
Yeah, I would always recommend also that when the people are looking at the organizational version, that they recommend the worker do the worker version on their own. Because again, there are so many strategies in there that people tell us they're able to use on their own without having to share. And that's really what we want people to do, right? Is to be able to feel like they are able to manage the work in ways that are empowering.
Okay, can the JDAPT tool be used by both workers and employers such as HR?
Yes, and we certainly have tried it, and we built the tool from the ground up with that in mind.
And you've got the two entry
and we've got the
right?
different versions, and they overlap, by the way. I should have mentioned that the worker version and the version that focuses that the organizational folks would use thinking about a worker, they're the same 24 questions. There's the same overlap with most of the strategies. The organizational version has a few more strategies in some cases, big strategies that a worker probably couldn't ask for, but the organization can think about in terms of training and skills building and other kinds of things that they could perhaps offer a worker.
Right. Awesome. Okay. Is there a specialist in this area that we can refer out to for one of our clients that has a disability with accommodation disclosures to us, but they can't or don't to an employer for lack of knowing how or support? I don't know.
Yeah. So unfortunately, we're a research team, so we don't do any consulting or advocacy, unfortunately. You can look at the website and kind of see different issues, but we're not able to do that. I mean, I certainly know there are others that exist that might be helpful here, but we are not able to. Sorry.
The next one is just a shout out from Dr. Gignac saying thank you for offering the tool in French. I'll follow up on that though. Are there any plans to offer it in any other languages?
Funds are a bit of an issue right now. So not at the moment. However, we had a conversation, I won't sort of say who because it was so preliminary, and we're going to be doing a presentation with a group. It could be that there will be some funds for the tool to be provided in Spanish. The challenge here is this is not just a translation cost. The tool is programmed, right, to give you different outcomes depending on the different things you say. And so it's the programming at the back end of the tool that creates some of the challenges. And we can't translate the website into the different, all kinds of different languages. I would love it if over time we were able to do some translations, but it would be a funding issue that we'd have to resolve.
Yep, always funding. Okay, this person is asking, how did the list of the recommendations for solutions come about? Can you describe that?
Yeah, so it took a much longer than we thought it would, but it's really come about by us scanning the literature, having colleagues who are experts in rehabilitation. We had medical colleagues who are part of the team. We have clinical psychologists. We have really a range of experts that we brought together to kind of make sure that we weren't giving any misinformation, we weren't going too far, and then looking in the literature to try to find different kinds of supports that have already been talked about. And we went beyond just sort of like illness literature, because I will say, particularly for the cognitive demands of work, a lot of those strategies are self-management strategies that you can find out there in the literature. So that's how it got built, with some rules about where we wouldn't go in terms of being too specific or not specific enough. or not, we're not going to say use this particular sit-stand desk, but, if you want to look into it, a sit-stand desk, that's up to you to kind of find the type that might be best for you.
And is that sort of also articulated in the publication?
We don't, I think, go through what our rules were for inclusion in the tool itself. But good question, Sandra. I can't remember.
I can't remember. Hey, I know that feeling. Anyways, I recommend people read the publication. I'm sure it's got lots of good information.
Yeah, and the 9-month evaluation study is under review right now. The early study is published. It actually won Best Paper at Journal of Occupational Rehabilitation 2023, and the evaluation study is under review. And if it comes back, I may have to add something about the rules for kind of including strategies, because I can't remember.
Yeah. Okay, that's exciting. Is there any guidance that you could give for dealing with employers who do not believe that an employee has an issue?
Yeah, that is really a tough question. It's something that we do here. Certainly the tool itself is, again, duty to accommodate legislation. I'm not a lawyer, but, employers are required to try to help to support workers. And the reasons for that, that you don't have to necessarily be specific. It could be that you have caregiving responsibilities. It could be there are some religious reasons, or it could be health reasons why you're looking to have your work be modified or supported in a certain way. And so having a conversation is something that workplaces are supposed to understand. This is, again, legislated. The tool could help you focus, so it's not like I want everything to change with my job. These are sort of the areas, and that can be helpful. We know from some other research that most of the accommodations people ask for are inexpensive, and a lot of them are already available, like flexibility with work hours and things like that. That might be helpful. I don't know who it is in the workplace that you're thinking of this person. If it's a supervisor who's a barrier, well, there might be someone in HR, and you can have confidential conversations with some individuals. You might also be able to get a health professional provide you with, some letter that you can take to others. So, I feel badly because I know many people are in this situation, but those are sort of some of the directions I'd start with. And sometimes there are workplace advocates that you can look into.
That's helpful. You've got so many questions. We've only got a couple minutes left here. Based on a worker using this tool, has there been instances where their response and results lead to lack of safe or suitable work for them on the employer standpoint? Thinking of this in a manual labor job mindset where certain levels of disabilities can be unsafe to have on site.
Yeah, so we don't have like examples from our study, but we do, for in the disclosure tool that we're creating, we do have a piece where we tell people if there is a health and safety issue, now legislation may require that you say something to an employer. If your health or safety is at risk or someone else's. The big example here is medication, right? If you're taking certain medication that makes you drowsy and you're operating equipment or driving or something like that. We haven't heard situations where employers have pushed back. We have heard that it's tough to have the disclosure discussion and workers can be worried about it. Because they don't want to lose their job, obviously, and they're concerned about that. Sorry, I can't be more helpful there.
Okay, I think this is going to be the last question that we can tackle. Would it be appropriate for a doctor to sign off on the JDAPT results in order for HR to, well, they've said take it seriously?
It's again, it's a good question. We haven't got to that point yet. I think, you know, the JDAPT is not a legislated tool. So a doctor could go, I think a doctor going through the tool with a worker and saying, yes, I agree with the responses that the worker and I have outlined here. I think these might be supports that we would suggest that would be helpful, because again, the workplace isn't obligated to necessarily use those supports. I think that a physician could do that, and I think, you know, it might be helpful if that kind of thing is done, but it wouldn't be, again, a legally binding necessarily, but I think it would be helpful in doing the planning and creating the kind of specificity that the workplace is looking for.
Okay, I'm feel very bad because there are still 10 questions, but we are at the top of the hour. And I know that, well, I'm very grateful to Dr. Gignac to give us her time today. Can I perhaps suggest that people reach out to you via email
Yes,
with their questions?
absolutely. Please do.
Okay, then apologies. But
And
I think it speaks to the level of the talk, the excitement and the number of questions that you've raised.
and thank you, and please feel free to share the links and the website. Put, you know, we've had one question we've had is, can we put the link on our website or share it in our organization? And absolutely, please feel free to do that.
Yeah, no,
Yes.
this is really good. If I can just take 1 minute to do a kind of closing acknowledgements. First and foremost, again, thank you. And I think everyone here agrees with me. Thank you for a fabulous talk today. I'd also just like to thank the Crush team, in particular, Toby Mankis, our marketing communication specialist, and Courtney Lessel, our research coordinator, who have been moderating and keeping everything running in the background. I'd like to thank the United Steelworkers Canada for supporting and funding this lecture series. I'd like to thank all of you, the attendees, for coming today and having such good questions. And just so that you know, the next lecture will be on October 4th. Should be by Dr. Burgess Limerick from Australia. And he's going to be talking about human health effects related to automation, with a special emphasis around automation in mining. So you'll hear more information about that. Look forward. Hopefully we'll see you again. And if I forgot anything, Toby and Courtney can fill me in. Otherwise, I say adieu and thank you, everybody.